Let's move on a little bit from arthritis and look at another autoimmune condition, which is autism spectrum, so ASD. And so this study was done in children. What they did is they used two flavonoids. They didn't just use quercetin, but they also used something called luteolin. So the combination of these two flavonoids they used in 50 children, 4 to 10 years of age, 42 boys, 8 girls, were enrolled in this 26-week trial rather. And so here was the conclusion. These results are encouraging in that the combination of the flavonoids, luteolin, and quercetin seem to be effective in reducing autism spectrum disorder symptoms with no major adverse effects. Show me a medication that you can use that improves symptoms without side effects. You can't do it. They all come with side effects. Quercetin, in this case, improvement of outcomes without side effects. Okay, let's look a little bit more. I was talking earlier about PCOS. Here's a couple of other studies. Again, human trials. And so we got 84 women with PCOS were selected for this trial. They were given 1 gram of quercetin for 12 weeks. And what was the outcome? Oral quercetin supplementation was effective in improving the adiponectin-mediated insulin resistance. So it improved their insulin resistance and hormonal profile of women with PCOS. Why is that important? Many women today struggle with fertility issues, and they're diagnosed with PCOS. What does the doctor do? Doctor puts them typically on metformin. And the problem with that is it doesn't fix the actual blood sugar problem. It masks it, it doesn't fix it. But metformin also depletes CoQ10, it depletes vitamin B12, and it depletes folate. So here we are, you've got a woman trying to get pregnant. Doctor says, let's get you on metformin. We control your blood sugar better. We'll have better effect on your PCOS. But simultaneously, you're inducing these deficiency states. What does folate deficiency lead to in pregnancy? Something called a neural tube defect. It's one of the most common defects in babies being born. And again, if the goal is to get pregnant and have a healthy baby, we certainly don't want to induce nutritional deficiencies. B12 deficiency increases the risk of miscarriage. And the reason I'm highlighting these things, and they don't have much to do with quercetin, but they do here, because you could use quercetin and increase PCOS, as I've shown you several human studies that validate that, without these side effects. And then CoQ10 deficiency also increases fertility problems, especially in the antioxidant viability of the egg. So I'm telling you not to take your prescribed medication, but what I'm telling you is to understand mechanistically that when you do that, you cause this, and when you cause this, you increase the risk of the very thing you're trying to overcome. And to me, that doesn't make a whole lot of sense. Everybody gets to make their own decision. However, now you're informed. You see this one, again, another study published not very long ago in Molecules. Quercetin is a natural compound of flavonoids found in a variety of foods and medicinal plants. It can intervene with the pathological process of PCOS from multiple targets and channels and has few adverse reactions. Quercetin can improve ovulation disorder, relieve insulin resistance, reduce excess androgens, and this is one of the driving factors behind PCOS as well, regulate lipid metabolism, regulate gut microbiota, and improve vascular endothelial function, which is this great significance in the treatment of PCOS. So these are all just mechanistic in nature, but helping you understand that better. So let's move on to men. So this was a double-blind, placebo-controlled trial in men with chronic prostatitis. So they enrolled 30 men with category 3A and 3B chronic pelvic pain syndrome and prostatitis. They were given 500 milligrams of quercetin twice daily for 1 month. So 1,000 milligrams for a month. What was the outcome? So there were two arms in this study. 67% of patients taking quercetin had an improvement of symptoms, at least 25% improvement. Now, there was another group that gave a product called Prostatitis, which is a blend of quercetin and another ingredient. And in this study, 82% had at least 25% improvement in their symptom score. So conclusion, therapy with the bioflavonoid quercetin is well tolerated and provides significant symptomatic improvement in most men with chronic pelvic pain syndrome. So if you've got prostatitis, chronic pelvic pain, you might just consider quercetin. Now stick with me, I'm going to be talking more about chronic pain directly with quercetin in just a moment. This is not just prostatitis pain or pelvic pain syndromes. Okay, here's another one on benefits of quercetin. This one specifically after intensive exercise. And so in this study, it was double-blind, 3 weeks of quercetin, 1,000 milligrams or a placebo. And what they found is that quercetin significantly reduced upper respiratory tract infection incidence in cyclists during the 2-week period after intensified exercise. So one of the side effects of super intense exercise is people get respiratory infections. They get sick because they push their bodies so hard. What this study is saying is that taking quercetin reduced the potential for their illness. Now let's go into more infectious disease. So let's just look at this chart. I told you earlier that quercetin's antibacterial, anti-inflammatory, antifungal, and antiviral. These are some of the mechanistic actions of quercetin, and these are studies done in cell lines and in animals. But you can see here quercetin, antibacterial activity, all the way down, and then we get into antifungal. Quercetin has antifungal activities, anti-inflammatory activities, antiviral activities. We talked about diabetes and blood sugar a moment ago. So a lot of benefit in the microbial foundation or microbial realm of quercetin. And let's talk specifically about what we used to say, the disease that shall not be named, the COVID. God forbid you talk about anything other than getting pumped full of chemicals without getting censored. But nonetheless, here we are. The therapeutic potential of quercetin against COVID. So this is what you're looking at here is the mechanisms of what have been discovered. The great thing about COVID was that a lot of research got done on a lot of natural treatments because doctors all over the world were looking for ways to combat COVID. And so here you can see that one of the effects of quercetin is that it affects the expression of ACE2 receptors in the lung and in the GI tract, which is where COVID can basically come into play. COVID docks into those ACE2 receptors, and that's how we become affected, but quercetin can help with that. We also know that as an anti-inflammatory and antioxidant, it can reduce that cytokine storm that so many people dealt with. We also know that quercetin can help to block the proteins produced by the virus. We know that quercetin is also a zinc ionophore. What does that mean? Is that it helps get zinc into the cell, and zinc has tremendous antiviral activity. I mean, one of the most effective natural antivirals in the world is zinc, and quercetin helps zinc get into the cells so that it can have that impact. So those are mechanisms. Now let's talk about human studies. And so I've got a summary of some of the studies that have been done. So this particular one, 21 outpatients, 200 milligrams of quercetin 3 times a day. What was the result? Shortened the recovery time and severity of COVID-19. Improvement in the blood parameters. So it improved something called LDH, which is lactate dehydrogenase, an enzyme that's released from damaged muscle and liver. Reduced ferritin. Elevated ferritin is a marker for inflammation. It also reduced CRP and D-dimer, also markers of inflammation. D-dimer is we mentioned CRP earlier, but D-dimer is a marker for microclotting of the blood. And so quercetin helped with that. Again, a human trial. Here's another human trial. 153 COVID-19 outpatients, 1 gram a day. They found a decrease in the recovery time, improvements in oxygen, and a reduction in hospitalization need. They also found that it had anti-fatigue. So many people are struggling with the fatigue, especially after the illness, and they found it had a pro-appetite. So it improved appetite in these patients. Then we have another trial down here, 250 milligrams twice a day. Again, these are really low doses, folks. I want to iterate that too. Like, quercetin is showing tremendous benefit at low doses. Imagine studies being done with 1,000 to 5,000 milligrams of quercetin. That's really what I'd like to see. But nonetheless, this is 250 milligrams 2 times a day. So 500 milligrams among 120 subjects, more protective effects against COVID-19 than the placebo. Okay, what else do we got? We got more COVID studies. 429 patients using a composition comprising of quercetin, vitamin C, and bromelain. By the way, when you put these things together, it's like supercharge. It kicks it up a notch. So what did they find? It improves the recovery rate and the blood parameters. 43 patients as a possible treatment of COVID-19. It decreased the recovery time and it decreased the symptoms of fatigue and cough of COVID-19 patients. So improvements. Again, we're talking about something that doesn't have any side effects, something that doesn't have any negative downside. It just helps. In this study, you can see here 200 milligrams 3 times a day, so 600 milligrams a day, shortened recovery time and severity of disease, improvement of the blood parameters. We've got down here, again, improvement in recovery time, oxygen, as well as anti-fatigue and increased appetite. So COVID-19 treatments with quercetin shown to be very helpful. Now, since we're talking about the immune system, let's talk about some additional elements here. So, anti-cancer potential of quercetin. This was a review. You can see here, quercetin is an outstanding antioxidant that has a well-documented role in reducing different human cancers. Quercetin exhibits direct pro-apoptotic effects on tumor cells. So basically it helps tumor cells kill themselves and thus can inhibit the progression of numerous human cancers. The anti-cancer effect of quercetin has been documented in numerous in vitro and in vivo studies that involved several cell lines and animal models. On the other hand, the high toxic effect of quercetin against cancer cells is accompanied with little or no side effects. I mean, that's all upside, folks. So how do you lose? At the very least, you could use it, and you don't have a negative side effect. At the very most, it may have potential impact of health. I showed you this diagram earlier on the molecular targets, the anti-cancer effects of quercetin. So these chemicals here, NF-κB and INOS, inducible nitric oxide, and COX-2, these are all inflammatory chemicals. So quercetin has an impact on blocking those inflammatory pathways. Same thing here with these mechanisms over here. And then it also has, as I said earlier, gene transcription inhibition effects. So it stops or lowers the potential for metastasis of cancer to occur. These are all the mechanisms. Now, one other thing that they're looking at quercetin to do, if you're being treated for cancer and you've got what they call drug resistance, because this is what happens, oftentimes is chemos lose their effectiveness and a person's cancer develops a drug resistance to the chemotherapy. So MDR stands for multiple drug resistance. So what they're saying is that major in vitro and in vivo findings are summarized showing that quercetin is a multi-drug resistant modulator and thus a potential chemosensitizer. In other words, it effectively improves in vitro and vivo studies, it improves the effectiveness of the chemotherapy and the treatment. So those of you that are going through treatment in that way, you may want to talk to your oncologist about using quercetin and reference that study. Now let's look at moving on away from cancer into other aspects of the immune system. So this is on a study done, double-blind study done on patients with allergic symptoms. So, we're talking about allergies to outside things, pollen and other things. So in this case, randomized placebo-controlled, double-blind, 66 subjects between the ages of 22 and 78 with allergic symptoms of pollenosis. Subjects were given the test product that contained 200 milligrams of quercetin or the control product daily for 4 weeks. What was the outcome? They found an improvement and a reduction in symptoms such as eye itching, sneezing, nasal discharge, sleep disorders were significantly improved. Conclusion, the results indicate that oral intake of quercetin containing supplements might effectively reduce some allergy symptoms derived from pollen or pollenosis. I have found that to be extremely true. And even anecdotally in my own family, my wife and son have tremendous fall allergies. And so we actually use something called Histacyst, which is a product it's a supplement product that has quercetin, but it also has nettle and vitamin C and bromelain, because when you put these ingredients together, they work really, really effectively mechanistically to the mast cells that release histamine have a membrane around them. And what these ingredients do is they stabilize that membrane so that overall less histamine is being reduced, which is why mechanistically why you see reduction in eye itching, sneezing, nasal discharge, and sleep problems, because you're not getting the level of histamine response because you're stabilizing that mast cell membrane. Okay, moving on. I want to talk a little bit about pain. It's one area I've seen quercetin work tremendously well. And so if we look at, this is a nice review paper on the mechanisms of how quercetin impacts pain. And so there's numerous different potential ways. Pain is a very complex topic, but one of the ways that it can impact pain is through the antioxidant effect. Remember, when you have tissue damage, there's a lot of free radicals that are produced that cause neurological irritation. And so having extra antioxidant can help to mitigate some of that. We know, too, that there's an anti-inflammatory effect created by quercetin. There's numerous mechanisms, interleukin inhibition or reduction, TNF-alpha reduction, NLRP and NFKB, all reduced, and those are all, again, inflammatory chemicals. We know that quercetin can aid in GABAergic inhibition. Now, if you've ever taken a drug like gabapentin or Lyrica, this is kind of a similar mechanism of action, only those drugs come with consequences like severe constipation. Quercetin does not. We know that quercetin helps to regulate synaptic plasticity, so it helps nerves recover much more effectively. So it activates the system, which can lead to reduction in pain perception as well. We know that there's an inhibition of glial cells that occurs, and glial cells are responsible for a lot of neurological inflammation, or nerve pain. So there's numerous mechanisms. You can see here, emerging evidence indicates that quercetin possesses anti-nociceptive effects in different rodent models of chronic pain, including inflammatory, neuropathic pain, and cancer pain. In this review, we summarize the mechanisms underlying these analgesic effects of quercetin in preclinical studies. Now, it's been my experience with quercetin that it's extremely effective. We actually use it. I'm going to get into some of these studies in just a minute, but we use quercetin. A lot of times when people come to me and they've got rheumatological arthritis or even just osteoarthritis, just tremendous pain, we combine vitamin C and quercetin. And the mechanism is that when you combine these two, there's a synergistic effect. There's a lot of foods that you'll find in nature, they always come to combine the two. Vitamin C and quercetin are in a lot of your citrus and other foods. But that synergistic effect on mechanisms of pain, and one of the areas that they impact is they impact the cell membrane where different inflammatory chemicals are being released. And so a lot of drugs target multiple aspects of this as far as pain is concerned. But when you combine vitamin C and quercetin in high doses, we use this a lot of times to pull people off of corticosteroids. So like if their doctor's got them on prednisone, for example, and the doctor doesn't want to keep them on prednisone, because any good doctor knows that high doses of prednisone over long periods of time causes bone loss, muscle loss, increases in blood sugar, and increases in blood pressure. So the goal is get the pain under control as quickly as you can, and then get off of the steroid as quickly as you can. Well, this is one way to help with that. We use this combination right here to help people get off of their prednisone faster with less potential complication and side effect. So what kind of amounts are we using here? With vitamin C, we're using 5 to 10 grams a day. The dose is high. And same thing with quercetin. Typically with quercetin, we're using 4 to 5 grams per day. So the combination of those two things. In essence, that's the experience that I have working with people to achieve better pain control. And a lot of times, this is just as effective as the medicine. So not for everyone, but again, it's non-side effect prone, right? So you don't have the problems associated with other pain medications. And so if we look at, let's just talk about that for a minute. What are those? As I mentioned, if you're talking about steroids, you get increased blood pressure, increased blood sugar or glucose. You get bone loss. You get muscle loss. And that's not all. Steroids also deplete vitamin C. Ironically, that we use vitamin C for that pain, right? Steroids are depleting that vitamin C. Steroids also deplete vitamin D, which has a major implication on pain as well. We know that steroids also reduce calcium. We know they reduce magnesium. We know steroids reduce zinc. So if you are on a steroid for a long period of time and you're not supplementing here, you should talk to your doctor about that, because it's these deficiencies that can actually drive a lot of this on top of the other mechanisms of using the steroid. But steroids are an option for pain management and pain control. It's just that they come with a slurry of side effects. One other thing that we didn't even mention is that steroids cause damage the gut lining. So, think leaky gut. So that's your steroid list of common side effects, common problems. That's a lot of dangerous stuff. What are the side effects of vitamin C and quercetin? At higher doses, quercetin can sometimes cause upset stomach and a little bit of tingling in the fingers. Vitamin C at high doses, just loose bowels, gas and loose bowels, but generally doesn't cause a lot of symptoms. Now, if you're prone to throwing kidney stones, or if you have a problem with oxalates, it can sometimes increase vaginal pain. But I mean, it's such a rare thing. We don't see that very common at all, even at these higher doses. So very low side effect profile at these higher doses, very high side effect profile here. Now, if we look at some of the other pain options, I mean, you could look at opiates, the different types of opiates, and those are all going to come with super huge addictive or addiction issues. But they also cause tremendous constipation, which is going to affect you nutritionally as well. And then there's evidence too that these also do damage to the gut lining. And then your other options, some of your other options are non-steroidal anti-inflammatories, things like naproxen, ibuprofen, even some of the COX-2 inhibitors like Celebrex. These are all going to damage the gut lining, but they're also going to damage the kidneys. And NSAIDs deplete iron, so they cause anemias. They deplete folate, and they also deplete vitamin C. So those don't come without consequence. And then beyond, these mechanisms, you've got acetaminophen or brand name Tylenol, and Tylenol or acetaminophen, causes a reduction or depletes glutathione, which is very, very important to protect your liver. And this is one of the reasons why mechanistically this stuff damages the liver. So if you're looking at pain options, there's always a side effect. It never comes without a cost. But when you're using quercetin and vitamin C, the potential for side effects is dramatically reduced. Now, all that being said, let's come back to what we were talking about here. You can see here the effect of quercetin supplements on selected markers of inflammation and oxidative stress. Here's what we know. Randomized double-blind placebo-controlled trial among subjects with systematic and regular exercise for 8 weeks in 4 groups, 15 individuals, 500 milligrams of quercetin, as well as vitamin C as well. And what did they find? 8-week supplements with quercetin and vitamin C was effective in reducing oxidative stress, reducing inflammatory biomarkers, including reducing CRP and interleukin-6, with little to no effect on E-selectin. So I showed you other studies on the pain-reducing effects in rheumatological arthritis with quercetin. What I'm telling you is combine quercetin with vitamin C if you really want to try to push for less overall medication. I mean, we also know there are a number of research studies that show that the use of quercetin and vitamin C in combination with opiates, like post-surgically when people are going in, if you give quercetin, vitamin C before the surgery, they need less pain medication after the surgery. They have less pain. There's numerous studies in humans that show that. So, this isn't information that I invented or I created. This is simply what the literature says, and clinically I've seen that play out time and time again for people. That's why if you look at my surgery protocols, and those are available online, pre- and post-surgery protocols that contain high doses of these things because they're effective. Now let's look at this here. So in this study, using vitamin C and quercetin against ibuprofen-induced renal damage. As I mentioned earlier, NSAIDs can cause kidney damage, renal damage. And this is a rat study, not a human study. But here's what they found. You see, ibuprofen, commonly used in management of pain and inflammation, has been associated with renal damage. So what did they find? Significant increase in malondialdehyde, urea, creatinine, and uric acid levels after ibuprofen administration. These are all markers of damage, by the way, kidney damage. Conversely, there was significant reduction in kidney parameters after administration of antioxidants with ibuprofen. So in other words, if you're going to take ibuprofen and you're going to apply what they learned in this rat study to yourself, what they found is that vitamin E, quercetin, and vitamin C offer protection against ibuprofen-induced renal damage. Again, this is a rat study, but I can just tell you from clinical experience, the impact is there in my experience in patients as well.